Imagine this. A frantic mother rushes her child to the hospital. High fever, trouble breathing, every second counts. But at the hospital, a horrifying reality sets in. No empty beds, not enough doctors. Her child's life hangs in the balance. This isn't some dystopian nightmare. This is the daily reality for millions in Mississippi, in a state where simply getting sick can mean financial ruin, where a trip to the doctor feels like a gamble, where the most basic human right, the right to affordable, accessible healthcare, is routinely denied. This is the story of the worst state in America for healthcare, Mississippi. Think about your own experiences, the frustration of navigating insurance networks, the sticker shock of medical bills. Now amplify that by 10. Imagine being forced to choose between putting food on the table or filling a life-saving prescription. This is the reality for countless Mississippians, where the healthcare system is in dire straits. In Mississippi, the healthcare system isn't just flawed, it's fundamentally broken. Politicians often prioritize profits over patients. Insurance companies wield significant influence over healthcare laws. And tragically, many Mississippians are paying the ultimate price. Let's talk cold, hard facts. The United States as a whole lags behind other developed nations in healthcare outcomes. But Mississippi? It takes failure to a whole new level. The numbers paint a bleak picture. Mississippi has the lowest life expectancy in the nation. Higher rates of chronic diseases like diabetes and heart disease. More preventable deaths compared to other states. These are human lives cut short, families torn apart, and communities devastated by a system that's supposed to heal, not harm. Imagine driving for hours just to see a doctor. That's the reality in many parts of Mississippi, particularly in rural communities. Hospitals are shutting down, doctors are in short supply, and basic healthcare services are few and far between. For those living in these healthcare deserts, getting sick can be a logistical nightmare, and for those with chronic conditions, it can be a death sentence. Let's talk about the elephant in the room, the outrageous cost of healthcare in Mississippi. We're not just talking about exorbitant insurance premiums, although those are certainly a problem. In Mississippi, the average insurance premium is among the highest in the nation. Co-pays and deductibles are sky high, and surprise medical bills can bankrupt even the most financially secure families. In Mississippi, simply going to the doctor can plunge you into a spiral of debt. It's a perverse system where staying healthy comes with a hefty price tag. Don't just take our word for it. Ask the doctors on the front lines in Mississippi. They'll tell you about the impossible choices they're forced to make, the patients they can't afford to treat, the corners they have to cut because of inadequate resources. Even the most dedicated healthcare professionals in Mississippi are hamstrung by a system that prioritizes profit over people. The result? Substandard care, misdiagnoses, and preventable medical errors. Meet Sarah from Mississippi, a single mother working 2 jobs to make ends meet. When her son developed a severe asthma attack, she rushed him to the ER. The bill? Over $10,000. Sarah's story isn't unique in Mississippi. It's a tragic reminder of the human cost of Mississippi's broken healthcare system. Families like Sarah's are forced into impossible choices every day. And for what? So insurance companies can pad their bottom line? It's time to shine a light on the culprit. The state with the dubious distinction of having the worst healthcare system in America is Mississippi. Yes, you heard that right. Mississippi, the state where politicians have consistently refused to expand Medicaid, leaving millions without access to affordable care. The state where insurance companies hold more sway than doctors. The state where access to quality healthcare is a privilege, not a right. This isn't just a problem for Mississippi, it's a national disgrace. We can't continue to tolerate a system that values profits over patients, that treats healthcare as a commodity rather than a right. We need to demand better access, better affordability, better quality. It's time to hold our elected officials accountable and demand real change in Mississippi. Because no one should have to choose between their health and their financial security. No one should have to suffer because they live in the wrong zip code. Healthcare is a right, not a privilege. And it's time we start acting like it. Mississippi deserves better.